Hello, in this video I'm going to be talking about targeted therapy. What is it? Who gets it? What types of treatment might you expect? And how does it interweave with other types of treatment as part of your breast cancer experience? So targeted therapy are treatments that have been developed to specifically target a particular protein or gene in the body or in the tumor itself. So targeted therapies are designed to attach to one part of the cancer cell, but they, of course, will also be received by normal cells in the body. Targeted therapies are called that because they're targeted towards a specific molecule, and the most common molecules we think about are the estrogen receptor, in the case of endocrine therapy, or the HER2 protein or gene. You can check out our video about the HER2 protein, how it's tested and what it means in the link here. So if we think about targeted therapies that have been designed to address a certain target, they're given only to people whose tumors have that target. So take the simple example of tamoxifen. If the tumor doesn't have the estrogen receptor, you can give that treatment all you want, but it won't be effective. Similarly, if your tumor has the HER2 oncoprotein, or there's amplification of the HER2 gene, if your tumor doesn't have an abnormal amount of the HER2 protein, you won't benefit from that treatment. Another form of targeted therapy is the CDK4 kinase inhibitors, and that works only in people whose tumors are positive for the estrogen receptor and, at this point anyway, HER2 negative. Specific targeted therapy for HER2-positive cancer includes trastuzumab and pertuzumab, and we have a separate video about both of those. Two other situations in which people would get targeted therapy are people who have a BRCA 1 or 2 mutation, in which case we use a class of drug called the PARP inhibitors, such as Olaparib. And these can be given to people with advanced or metastatic breast cancer, but also to people with early stage disease who have a lot of cancer left after receiving chemotherapy before surgery. Another situation in which we give targeted therapy is in people with advanced or metastatic disease whose tumors have the PIK3CA mutation, in which case we can also give targeted therapy specifically for that mutation. I am sure the indications for targeted therapy and the types of people who get them is going to continue to expand as we advance the science of breast cancer care. There are other targeted therapies that are used in advanced or metastatic cancer. I won't go into those in great detail. What I would like to do is encourage you to go to Yerbba.com to get your personalized report. The report goes through everything that's been done in terms of diagnosis and treatment so far, everything that's known in the medical record, and then cross-references it with the latest medical research and generates a report that's updated as new things come in that are personalized to you. This is different from the portal, which is a way you communicate with your team and get access to your reports, those patient-facing reports. It's different because it actually goes deeper, much deeper into your medical records, and it's cross-referenced with the latest medical information and updated in real time. So I'd love to encourage you to go there if you're curious about learning more about the role of targeted therapy in your case. How is targeted therapy given? Well, it can be either given by intravenous injection or sometimes by mouth, depending on the treatment. It's also known that some HER2-directed therapies work if given under the skin. One doesn't even have to have an IV, though that's not that common in the US. In other parts of the world, subcutaneous targeted therapy has been given. It's given along with, usually, chemotherapy or endocrine therapy, though it continues in many cases much longer than that. So if chemotherapy is 3 to 6 months in early stage breast cancer, targeted therapy is given for up to a year. If you have advanced disease, targeted therapy may continue even if your endocrine therapy is changed or if your chemotherapy is changed. So it really depends on your particular situation. Another reason to go to Yerbba.com to get your personalized report. Thank you so much for watching, and we'll see you next time.